Now, the world should put more concerted efforts in tackling HIV/AIDS. That's been one of the key messages at the 25th International AIDS Conference in Germany. More than 10,000 participants are taking part in the global gathering to re-galvanize support in dealing with HIV/AIDS. UNAIDS says about 40 million people across the world are living with the virus. South Africa is represented by Health Deputy Minister Dr. Phaahla and other delegates. Let's now speak about this to Eva Kiwango, UNAIDS South Africa Country Director. Thank you so much, Eva, for your time. Let's just start with, obviously when we hear global picture, and we get a sense of how numbers are looking globally and how efforts to tackle HIV/AIDS are globally at times, the picture at home, it's sometimes, missing. So give us a sense of how things are looking on the South African front.
Thank you very much, Bongiwe, for the opportunity to talk about the new UNAIDS 2024 Global Report titled The Urgency of Now, AIDS at a Crossroad. So globally, yes, there are 39.9 million people living with HIV, 1.3 million new infections, of which 120,000 are children, and 630,000 AIDS-related deaths. In South Africa, we have 7.7 million people living with HIV. There are around 150,000 new infections in 2023, 6,500 among children, and around 50,000 AIDS-related deaths. And I must point out here that we have seen dramatic reductions in new infections and AIDS deaths across the board.
When we talk about new infections, what does the report reveal around women, for example?
So with regard to women, we have bent the curve of new infections to, below 50% from 2010. However, the new infections have not decreased sharply enough. So there's much more that needs to be done there. We still know that there are around 1,000 new infections among young women and adolescent girls every week. So our prevention programs are not yet where they need to be. We need to do more in terms of differentiated, people-centered, precision prevention programming across the country.
And I suppose, I remember we had this conversation with an activist last year, especially looking at the issue around adolescents, for example. You think about the fact that in some of these instances, they try to go to some of the healthcare facilities and they may then be afraid because some of the officials or maybe the healthcare workers that they would find at some of these institutions are not ready to have some of the conversations with them and will simply just tell them they're too young, possibly, in some of these instances to come through and use these facilities.
And that is why one of the key messages in the report that we launched yesterday was the need to tackle discrimination and stigma that are pushing away marginalized people, vulnerable people like adolescent girls and young women. We know that in our region alone, in Eastern Southern Africa, 27% of new infections are among girls and young women. And they're 3 times more likely to acquire HIV than their male counterparts. And this is because of power. It's because of social norms, toxic norms. It's because of we're failing them in terms of, providing them with the necessary knowledge. But it's also because of the attitudes that they find in clinics. And it was really well received when the Department of Health put in place a program to create youth-friendly zones. But we need to do more for them. Yes, you're right.
And I know UNAIDS, of course, often partners, with some strategic partners in order to collaborate, to try and put strategies in place to deal with this. Let's talk about how are you now looking at maybe re-strategizing to deal with some of the challenges that are released in the report?
Well, the report calls for us to mobilize resources for the response. We know that there are polycrises across the world, from wars to climate shocks, and this has resulted in a shrinking of donor resources and continued cuts. So the funding gap is widening, and the report demonstrates that the cost of not ending AIDS would be exponentially higher than the cost of ending AIDS. So we're working closely with the government of South Africa, with the South African National AIDS Council, to mobilize international resources and to make sure that domestic resources are not reduced. But we also need to work closely with the government, and we're doing this globally, to tackle the debt crisis, because we know that in some countries, and South Africa is also impacted by this, governments, revenues that governments collect, they're using more than 50% of them to service the interest rates on debt.
So when then it comes to, the issue around treatment, where are we in terms of the research that's out there as well as the progress?
So South Africa has made considerable progress in terms of treatment. It has around 19% of the total number of people living with HIV globally, and it has the largest treatment program with 5.6 or 7 million people on treatment. So in terms of the treatment cascade, normally referred to as 95, 95, 95, approximately 92% of people living with HIV know their status. 75% of those who know their status are on treatment. And those on treatment, 89% have achieved viral suppression, which means if it's below 50 copies per milliliter, that they are not able to transmit the virus, which is why the Department of Health launched the undetectable equals untransmittable campaign earlier this year. However, 2 million people are not on treatment. And so there are some challenges that we need to continue to address. And this includes children. We're failing our children. And as you very well know, we have a global alliance. South Africa is part of the global alliance to end AIDS in children. And we are working closely with partners, with the government, with civil society, and the Second Lady of South Africa as our patron to find these children and put them on treatment.
Briefly then, what does it mean for the 95, 95, 95 targets?
What does it mean for the 95, 95 targets? It means that we have to do more in terms of, scaling up access to treatment for adolescents. We need to find around 75,000 children below the age of 15 and put them on life-saving medicines. We need to scale up, pediatric dolutegravir, so transitioning kids to this more favorable medicine. We need to strengthen integration between EMT, prevention of mother-to-child transmission services, and your maternal and child health services, so that there's integration, so that we don't lose these mothers and their babies when they leave the clinics, when they're going for immunization. But we also need to address inequalities. Gender-based violence, stigma, poverty are all contributing to us losing these children. And we need to support the scale-up of pre-exposure prophylaxis for pregnant and breastfeeding women.
Certainly, a lot has been done, and as you say, a lot more work remains. But thank you so much, Eva, for your time and for just giving us a picture of how things are looking here at home. That was Eva Kiwango, UNAIDS South Africa Country Director.